Hi, this is Dr. Jun Reyes, your physical therapist. I am based here sa New York. Napakaganda ng ating topic ngayon. Ang topic natin ngayon ay paano mapapababa ang hypertension or paano mapapababa ang high blood pressure. Dito pa lang sa United States, there's approximately more than 108 million people ang hypertensive or nagtatake ng hypertension medication. So ngayon, ipapakita ko sa inyo ang natural way paano natin mapapababa ang blood pressure. Ano nga ba ang blood pressure, ang high blood pressure? Ang high blood pressure, very common ito, tinatawag din itong silent killer kasi there's no symptoms. The next thing we know, makikita na lang natin, chine-check sa ating clinic, sa doctor's clinic, tumaas agad ang ating hypertension. Pagka sinabing hypertension na or elevated high blood pressure, ibig sabihin nito mataas sa 120/80. Okay? So ang normal blood pressure natin below 120/80. Yan ang normal blood pressure. In sa 2017 blood pressure guidelines, ang normal blood pressure is less than 120 for the systolic upper number, and sa diastolic pressure naman is less than 80 degrees. So less than 120/80, that's a normal blood pressure. Elevated blood pressure or pre-hypertension is between 120 to 129. That's the upper number, at yung diastolic pressure is less than 80 ang diastolic pressure. Pagka sinabi ng hypertensive stage 1 or hypertension stage 1, that's between 130 and 139. That's a systolic pressure, and the diastolic pressure is between 80 to 89. And high blood pressure stage 2, it's a 140 or higher, or 90 or higher per the diastolic pressure. Pagka mataas na sobra ang blood pressure, that's the hypertensive crisis. That's higher than 180 or higher than 120 for the diastolic pressure. Yan ang 2017 blood pressure guidelines. Ang una-unang pinapayo ko sa aking mga pasyente, the natural way, ay mag-exercise. Based sa study na ginawa back in 2013, sedentary lifestyle yung mga participants, ay nag-exercise sila ng 40 minutes. Aerobic exercise, 40 minutes, 3 to 4 times a week. After 8 weeks, chinek yung blood pressure nila, nag-lower ang kanilang blood pressure or hypertension ng 4 to 5 points. Imagine, that's like taking hypertensive medication. So yung mapababa ang systolic pressure ng 4 to 5 points, and then diastolic pressure 3 to 4 points. So para siyang hypertensive medication, basta gawin lang ito tuloy-tuloy. That's number one. This sa atin na mag-exercise 3 to 4 times a week for 40 minutes. And yung best daily exercises for seniors, napakaganda nun. Yung pinakita ko sa inyo, best daily exercise for the seniors, kompleto yun. There's aerobic exercise, there's balance training, there's range of motion, stretching. You do it 2 times, kompleto nyo na yung 4 minutes na yun. Do it 3 to 4 times a week. Walang tigil. So, yan ang pinaka-importante ipapakita ko sa inyo kung ano yung best daily exercise. Okay, number 2. Ang number 2 na ginagawa ko sa mga pasyenteng may hypertension niya, ginagawa ko yung deep breathing exercise or a combination of pursed lip breathing, belly breathing. Napababa ko yung blood pressure ni Heiser ng 20 points. Mamaya ipapakita ko sa inyong video. Ang paggawa ng deep breathing exercise ay just inhale through the nose and then exhale through the mouth. Whether it's a 4, 7, 8 or 4, 5, 6, just do it for 5 minutes in relaxation. You can actually close your eyes. Mag-inhale lang tayo and then exhale. Yan. Or you can just inhale through the nose, exhale through the nose. They actually have studies na yung inhalation and exhalation through the nose, may stimulate natin yung parasympathetic system. Yung parasympathetic, magdi-decrease ang ating heart rate, ang breathing rate, nababawasan ng stress. Do it for 5 minutes. Do it just regular breathing, relaxation. So inhale, or inhale through the nose, hold it for 4 seconds, and then exhale through the nose. Actually, there's a studies that they did na yung inhale through the nose, exhale through the nose, it actually stimulates the parasympathetic better than inhale through the nose but exhale to the mouth. I don't care whether it's inhalation through the nose, exhale through the mouth, it's all the same. What I did with Heiser, I showed them how to do a deep breathing exercise. It actually lowered his blood pressure by 20 points. I'm gonna show you the video.
Video na ito, pinapakita ko yung blood pressure ni Heiser. Checking his blood pressure. Ang systolic pressure niya is 161/76. So mataas ang blood pressure niya.
And inhale, exhale slowly through the mouth.
Okay, after doing the deep breathing exercise, we're gonna check the blood pressure. Sa video na ito, makikita niyo na bumaba ang blood pressure niya ng 20 points after breathing exercise.
Number 3, ano ba yung mga pagkain na dapat nating kainin para mabawasan ang ating hypertension or bumaba ang ating blood pressure? Number 1 para sa akin, and they did a lot of studies, they did a lot of research, ay ang pagkain ng raw garlic. 3 to 4 pieces o 3-4 na pirasong garlic or 4 cloves of garlic every day. Based on studies, napababa ang blood pressure ng 11 points. Between 6 to 11 points. It's equivalent to taking hypertensive medication. Ano ba ang meron sa garlic? Ang garlic meron tinatawag na active ingredients na allicin. And allicin inhibits the production of angiotensin II. Ang angiotensin II, yan yung nagpapataas ng blood pressure natin. And also, it stimulates the production of hydrogen sulfide and nitric oxide. Yan yung dalawang na-stimulate. Pagka kumain tayo ng garlic, mapapababa ang ating blood pressure. That's responsible for dilating our blood vessels, lower our blood pressure, so mapapababa ang ating hypertension just by eating raw garlic. Dapat inumin naman yung beet juice. Based on studies, randomized controlled trials, ang pag-inom ng beet juice, mga 8 ounce every day, twice a day, nababawasan ang ating blood pressure because of high in potassium, magnesium, and folate. The same thing with pagka kumakain tayo ng spinach or kangkong. Yung mga active ingredients na yan, yung folate, magnesium, potassium, yung combination of key ingredients, nababawasan ang epekto ng sodium, yung salt, yung pagkain ng salt. Pagka kumain tayo ng spinach, bumababa ang epekto ng salt when you're high in, yung diet mo high in potassium. And yung magnesium and folate, they're responsible to protect our arterial wall. So, very effective siya. Kumain tayo lagi ng spinach and kangkong, uminom ng beet juice, bananas, omega-3 fish oil, yan. They have studies, moderate effect ng omega-3 fish oil like salmon sa ating blood pressure, sa ating heart, effective siya. Yan, yung mga dapat kainin. So of course, lower tayo sa pagkain ng sodium. Again, yung mga pagkain na high in potassium, mag-ingat tayo sa mga may pasyenteng may chronic kidney condition or chronic kidney disease. Tanungin, make sure you ask your doctor kung safe kayo kumain ng high in potassium diet. Ano ba yung mga bawal kainin? Of course, yung mga processed food, high in sugar, yung mga spam, yung mga bacon, yung mga tataas sa salt. So, again, ang recommendation ng American Heart Association, it should be 1,500 milligrams Yung sinabi ko kanina, isang tuyo pa lang, isang dried fish is 200 milligrams of salt. So, kung kumain tayo ng tatlong tuyo or dried fish, 600 milligrams pa lang sa umaga pa lang yan. And then yung spam, makikita nyo, lalo na yung corned beef, yung mga processed food, canned goods, they are high in sodium. Soup, they're high in sodium. So, bawasan ang kain ng maalat at limitahan lang siya ng between 1,500 milligrams to 2,000 milligrams, okay na yon. Yan yung tatlong tips ko sa inyo. Kung sa tingin nyo nakatulong itong video na ito, please like and share. Share this video para mas madami pa tayong matulungan na kababayan. And also, please don't forget to subscribe. Subscribe sa ating YouTube channel. Dito, please hit that subscribe button. Alright? God bless and take care.